Sir, audio is not available.
Sai, just let me know, Sai, when we are live.
It's live.
We are live.
Yeah.
We are live. Right.
Yeah.
Okay. So, hello to all my dear students. Welcome to this session by DocTutorials. Myself, Dr. RahulRajeev, Medicine Faculty at DocTutorials. With me, I've got the esteemed National Faculty for Surgery, Dr. Rajamahendran sir, who is a very renowned surgeon, teacher.
Good evening, sir. Good evening, sir. Good evening, sir. Nice to meet you.
So, sir is also the
Yes.
author of leading books like Surgery 𝗥𝗷𝗵𝗵𝗃, and also he has written practical books on surgery as well. I'm sure many of you are following that for your final exam preparation as well. So we'll begin today's session without wasting any time, because final MBBS exam preparation is all about valuing time. You have got to judiciously use your time. So we are not going to waste any time. We are going to move forward to the topic. And so I just share my screen with you. Just let me know if my screen is visible. Right. Right. I think, sir, my screen is visible.
Yes, sir. Your screen is not yet visible, sir. Yeah, now it is visible.
Okay, right.
Now it's visible, sir.
Yeah. Okay. So to all my dear students who have just joined into final MBBS, I'm sure that there are lots of anxiety and apprehensions about your final MBBS. So what we'll be doing in this very short session, maybe 30 minutes or so maximum. So in this short session, what we'll be doing is we'll be guiding you towards your final MBBS journey. Medicine and surgery are two important subjects of final year. In fact, you can call it the pillars of final MBBS. So how to plan and strategize your final MBBS preparation, especially regarding these two subjects, is what we'll be discussing. You will have separate sessions for other subjects like OBG Pediatrics by faculties of DocTutorials. So please, keep waiting, and you can tune into this YouTube channel for those sessions as well. So today, the focus will be on medicine and surgery. So first, what I want to tell you is an overview of final year. So as you can see in your screen, what I strongly believe is that for your final MBBS preparation, there are 4 P's which are important. Number 1 is planning. Number 2 is prioritizing. Number 3 is persistence. And number 4 is practice. Very briefly, I'll just tell you what I mean by each of these 4 P's. Number 1, planning. Now, when you begin final year, okay, suppose I know that most of the listeners have just joined into final year. When you begin final year, see, you have got lots of portions in front of you. You have got to cover them. You have got to memorize them. You have got to write the information in your exams as well. So it's not easy, right? So you have got to plan the final year journey. What happens to many students is that during final year, when they join final year, they work hard, they study well, but they do not plan properly. And do you know what happens? 1 month before the final exam or 2 months before the final exam, you see that you've got lots and lots of portions to cover, and then you begin to panic. Okay. So you have got to avoid panicking in the crucial moments near the exam. And if you have to avoid that panic, you have to plan early. Now, this planning is important even if you are a very bright student or even if you are someone who has not done so well during the previous MBBS prof exams, but still you have that determination. I should do well in final year exams. So this planning is very, very important. Okay, so you have to plan. You must see how many months are there in front of you, how many subjects are there. See, I know that for certain universities, you've got ENT and ophthalm as a part of final year. For certain universities, for most of them, they have already written ENT and ophthalm. But for universities having additional ENT and ophthalm, that is an additional burden for you. So you've got to properly plan. See, how am I going to finish these topics on time? You've got to give enough time for revision towards the end. Otherwise, you're going to stress yourself. So that is number one about the planning part. Number two is prioritizing. How is prioritizing important? See, suppose if you are currently posted in the medicine ward, and today morning in the medicine practical classes in college, suppose you had encountered a case of pleural effusion. So you want to come and read about pleural effusion. At the same time, you have this in your mind. Should I just be reading what I saw in the practical class today morning, or should I read topics of theory as well? Now, or should I just look at topics of other like surgery as well? My ongoing posting is medicine, but should I read surgery topics as well? You will have multiple questions in your mind. And for this, prioritizing is important. If you are having an ongoing medicine posting, the most important thing is that you try to cover most of the medicine topics during your posting. But I would strongly suggest you do not neglect surgery and OBG. Read something about surgery and OBG even during your, and pediatrics obviously, orthopedics also, during your medicine posting as well. But majority of the time during a medicine posting should be devoted to your medicine subject. So that is how you prioritize. Now, if the prioritization is not correct, suppose you are attending medicine posting, but 70% of the time you are reading surgery. Then what happens is that, when the medicine posting is ongoing and you are daily seeing cases in the ward, but you do not know how to take the case properly, or how to assess a case of stroke properly, how to assess a case of a valvular heart disease properly, how to take a history properly, then what happens is that, you get stressed out. You do not know how your, studies are going, it is totally going to be haphazard. So it is very important to prioritize your studies. Number three is persistence. Now, what is the importance of persistence? Now, ever since this final MBBS has started for colleges across India, I have got messages from multiple students telling me that, sir, I am getting so stressed. It seems already so overwhelming. Lot of topics to cover. My basics are not correct. So I don't know how I'm going to survive this final year. Let me tell you, see, the journey is a long one. And for that, you will have to have good persistence. Take small baby steps. Nothing magical is going to happen in a few days. But with continued persistent effort, you will see progress. But it has to be persistent effort. So I want you to work hard, work sincerely, and you will see that the change is reflecting on your performance. As a few weeks go by, you will see that, okay, you're gaining more knowledge. But there will be certain days where you are not able to study properly. Like you've got some presentation in college. So last 2 days, you had to prepare that. So some days may not be as good as you would have expected. You might not have done well, or you could not read well. But that will be there. That is how life is. You will not have good days always. So you will have some good days, you will have some bad days, but whatever it is, have persistence. Now, next is about practice. Now, practice is very important. See, this is important both for your prof exams and also for students preparing for the PG medical entrance exam along with your prof exams. See, I'll first talk about the prof and then about the MCQ part, that is the entrance part. About the prof part, see, one common mistake that students do is that when they learn medicine, they just go totally haphazard, haywire. They start reading from the first line of the textbook, thinking that let me try to master medicine. But then you see that you are not progressing. Every day you are reading 1 or 2 pages and it's not going beyond that. Then you become stressed out. How am I going to finish whole of medicine? I've got these many subjects to cover. So it is very important that you practice properly. Practice what? Practice questions based on the previous university question papers. Now, when I mean practice question papers, what I mean is that before you learn any topic, say for example, cardiology, I want you to go through the previous university question papers and assess, okay, which are the topics which are having more weightage, more mark distribution. So going through these previous year question papers and then analyzing which topics carry more weightage and then coming back to the textbook, okay, that will give you a relative idea, okay, which topics to be focused more. Because see, don't think that medicine or any other subjects in final year can be completely mastered. Even somebody who has done MD medicine or DM in a particular subspecialty is never going to be the master of that subject. Okay, you are a student, I am also a student. Everyone is a student for life. So, but what you have got to understand when you're facing a competitive exam like a prof exam, you will have to see which are the topics which have got more yield. So you have got to, for the prof exam point of view, the practice of questions has to be from the previous year question papers. But the practice is more important in your entrance exams as well, because many students ask me, sir, is it possible to balance theory exam preparation along with the entrance? Because sir, my basics are not strong. I don't think I will be able to manage it. But if you study in a smart manner, the actual point is it is still possible. If you can focus well and if you can practice MCQs during the preparation itself, you will be able to cover. Okay. Now, as far as the platform of DocTutorials is concerned, I just want to share with you something very, very unique that we have come up with. See, you know that in majority of coaching platforms, the MCQs are not framed from the corresponding subject specialist, because of which there are so many errors in the question bank. Now, this time, what we have decided in DocTutorials is that, see, we are not going to go for any substandard question bank. We have got to go for the best question bank. And how can we do that? The responsibility lies on individual faculties. So what we have done is, the current DocTutorials question bank, which has been recently revamped. Okay, I'm not talking of the previous question bank, recently revamped, has questions which are framed from corresponding subject specialist. So that means, the corresponding faculty is putting the questions. So the questions are aligned with the lectures. So what you can do is that you can practice MCQs and then you can assess your preparation. So what I would suggest to you is, when you finish cardiology, a few modules from cardiology you are done with, then what you should be doing is that you should be practicing MCQs from that module. Okay, so that is very important, because when you repeatedly practice, it is going to help you not only for the theory exams, it is going not only for the MCQ exams, it is going to help you for the theory exams as well. I know some of you may be surprised. How does practicing MCQ help you for theory exam? Look, when you practice MCQs, one thing is, yes, you are improving your MCQ solving skill, but along with that, it helps to reinforce your knowledge. Now, suppose, you have read the topic of systemic lupus erythematosus, okay, and then you are solving some MCQs on systemic lupus erythematosus, and then they give a clinical scenario of an autoimmune hemolytic anemia that is happening in the setting of an SLE. You see that clinical scenario and you're not able to make out the diagnosis. Now, how does this happen? How does this happen? But then when you look at the explanation and then find out, oh, this is how autoimmune hemolytic anemia can be one of the hematological manifestations of SLE. That is when you realize, okay, I've read this, but at that time, I did not give much emphasis to it. So it helps in reinforcing your knowledge so that when you write your theory exam as well, such points, it will click in the time of the exam. So it is very important you practice MCQs also along with this. Now, this is about the 4 P's of the final MBBS exam preparation. Okay. Now, the remaining part of the discussion, we have got two parts to the discussion. Number one, our esteemed faculty, Dr. Rajamahendran sir, the ace faculty for surgery in the country, sir will be discussing about the preparation for final MBBS surgery exam. And I would request sir to discuss 3 points. Number one, surgery theory. Number two, surgery practical. Number three, MCQ practice along with this. So, Rajamahendran sir, could you please guide the students on final MBBS surgery preparation, sir?
Hello, sir.
Yes, sir. You're
Hello?
audible. You're audible,
Yes, sir. Am I visible, sir?
Yes, you are visible. I'll just stop my screen.
Okay, sir. So, hi, friends. So, nice to see you on a very important session, how to prepare for final MBBS, medicine and surgery. So, the two important subjects, as sir told, sir has given a very clear overview of how to approach this 1 year of final year preparation. So, first thing I want to answer, as some of the students have already messaged in the YouTube, most important thing is don't worry whether you have read properly for the past 3.5 years or not. So you might be a very bad student or worst student. You might have a very bad basics. Don't worry about it. This is the 1 year, very important year where you are going to strengthen your entire concept. Because I can say even when I'm doing final year, I have never prepared in the first, second and third year and all. Only in the final year, I got the seriousness that we have to be serious with the preparation and entered into the final year preparation. My final year preparation was hectic and I used to prepare at least 4 or 5 hours daily coming after the posting. So I used to prepare notes, everything self-made notes, that notes only what you are seeing now as the books. So I'll tell you, very important this 1 year. This 1 year is going to save a lot of patients from you. So you are going to treat the patients based on this 1 year study only. So though I am a surgeon, I can diagnose medicine cases. I cannot treat them, but I can diagnose medicine cases and I will use to refer them medicine. Only during the PG preparation, we read MCQ oriented way. But this final year preparation, clinical preparation is going to be very helpful. I'm telling you, clinical preparation is more important than theory preparation. So especially when you come to surgery, in surgery, you should be very strong with all the long cases and short cases. I'm telling you, if you are strong in long and short cases, 60% of the theory questions will only come from the clinical questions. So for example, essay question on breast will be there, essay question on varicose vein will be there, essay question on cancer stomach will be there. Most of the clinical questions will be asked in the theory also. So your first aim, once you enter the final year, is to strengthen your clinical concepts. So read one by one. Don't get stressed. Read one by one each case. For example, you are going to read hernia case. Read it thorough. Don't read superficially. The most important thing I will tell you finally is don't read anything superficially. You should read any topic you are reading from basics. Now it's the time to take back the basics. You might not have prepared anatomy well during the time. Just read anatomy of hernia and be thorough with the hernia topic. So similarly, when you're going to read cancer stomach, go back to your pathology book and read some points from pathology. And you have to prepare cancer stomach from Bailey and Love or from long cases surgery. So whichever source you are going to use the material in depth. Don't read superficially in your final year, especially for theory topics. You can read superficially, but clinical topics, you must be having everything in your fingertip. You should know every advances, latest concepts, everything you should know in clinical concepts. So as sir told, my first priority should be to the clinical topics, because these clinical topics, either it is a medicine or surgery or OG, will be coming to you in future practice also. So strengthen practicals first. Put as much as time possible in the practicals. You should be thorough with all the clinical cases. And after that, you can go for theory. So theory, what are the contents to be read in theory? Surgery is very simple. There are only few non-clinical topics in theory. Example, shock is a non-clinical topic. So trauma is a non-clinical case topic. So in surgery theory, I will strongly recommend you to go through all the emergencies. So that emergencies only will come as theory questions like acute pancreatitis, trauma questions, shock question. Most of the questions you get in theory will be emergency questions, because as a final year student, you should know how to manage an emergency, at least theoretically. No need to know practically managing a trauma case, because nobody expects an MBBS student to go and manage a head injury or a thoracic injury. They will only expect you what to do, where to refer by doing a first aid. That is what we have to learn in the final year. You should be strong in your theory part. So first you be thorough with the clinical part, then you should be thorough with the theory part. So third thing, as Rahul sir said, there is always a confusion. Should I prepare along with this? Should I prepare for NEET PG? So I'm telling you, when you are going to prepare MCQs, definitely you are going to strengthen the same concept. Whatever you read in the theory, you are going to strengthen the same concept. So for example, you are reading trauma in Bailey and Love, or from any other source like SRB or Manipal, some book you are reading trauma. For example, you are reading an abdominal trauma. And if you are going to put that MCQ in QBanks, either it is any QBank, whichever you are following, our DocTutorials QBank is latest with the new updates. So if you are going to do question bank in trauma from DocTutorials, every question is taken directly from Bailey and Love. So you will understand the other side of the same theory. So whatever you read as a theory, you will see the other side as MCQ. So that concept gets strengthened. So you can strengthen your concepts by doing MCQs. So sir, will this time will be sufficient? I'm asking, many students will ask, sir, will this 1 year sufficient for medicine, surgery, OG, pediatrics, ortho? We have to read so many subjects. I'm telling you, this is the only 1 year you have to put full efforts. If you are going to put full efforts in this final year, you are going to shine extraordinarily as a clinician in future. So don't worry about whether you have prepared well before or not. I'm again and again telling, even I am a very poor student. First year, second year, third year, I fought so much difficulty to pass the exams because we all the time roam in the hostel. We never used to read. So all the time enjoying culturals, programs, movies, etc. Only when I came into final year, I realized that this is very important here and we should learn everything and we should be strong in the clinical concepts. So I'm telling you, don't worry about whatever happened so far. And I will tell you, there are some questions from the students related to the books. So let me start with the books. So theory books. Theory book, anybody, if you ask, I will tell the best book is Bailey and Love. So many of you might feel, sir, how to read Bailey and Love? It is very big. Yes, Bailey and Love is very big, but that is going to be useful for your NEET PG in future. Every question is going to come only from Bailey and Love. I'm not asking you to read entire Bailey. Take your university questions and mark the questions and read only those questions from Bailey and Love. That is enough. No need to read entire Bailey. Just read, for example, shock is a essay question. Read that question alone from Bailey. Acute pancreatitis, read that question from Bailey. Read only selected essay questions from Bailey and Love. And you might feel there are so many Indian authors books like SRB, Manipal, all these books are extraordinary books, but there will be no MCQs in future from those books. So you might feel it is very easy to read SRB and Manipal, but that is not going to help in long term. So if you are going to read Bailey and Love, definitely you will like to become a surgeon. That much contents are given extraordinarily illustrative way. So try to read Bailey as much as possible. If you feel I'm unable to read Bailey, you can go for Indian authors book. And in theory, I'm telling you, you will not have sufficient time to read everything. Read only the essential essay questions and important short note questions. That is enough at this point of time. So yes, Doc has asked which surgery book is best. So SRB, Manipal, both are more or less equal. Manipal is undergraduate level. SRB is postgraduate level. So undergraduate level, if you want to just pass and go, Manipal will be good. If you want to go score high score, honor, distinction, you should go for SRB. If you want to crack the PG entrance exams in future immediately, that is best is Bailey and Love. So these are the three theory books. And clinical books, as you know very well. So long cases surgery and short cases surgery, both the books are accepted very well by many universities. My long cases and short cases book. And new edition is coming for both the books in next 2 months. So both long cases, short cases, new edition is coming up. So if you have a old edition, you can keep reading that. Or if you can wait for 1 or 2 months, new edition will be released by the publications. So, and whatever it is, definitely you should read Das. Because in my long cases and short cases book, I would have not demonstrated the clinical examination science, which is very well demonstrated by Das with the pictures and images. So you must go through important clinical examination findings in DAS if time permits. Especially when you go to the wards, use the clinical case DAS and do the clinical examination based on DAS. That will help you for long term. So this is about the surgery. I think RahulRajeev sir, anything else you want me to tell related to surgery preparation, sir?
Sir, I have just one query regarding MCQ practice. So suppose if somebody is watching your lecture from DocTutorials, so what should the student do? First read Bailey and then watch your lecture, or watch your lecture and then, do Bailey and then do the MCQ? So what should be the order? This is one question which is asked by the students.
So actually, I feel they should watch the lecture first, sir, because we have illustrated the same content in Bailey in a more illustrative way. So when they see the Bailey and Lau, so directly they may sometimes feel they could not understand. So I feel they should watch the video. For example, they want to read CS stomach, see the CS stomach video in DocTutorials, and then if they go to the Bailey and Lau, definitely they will understand each and every point. In fact, in our videos, I have added some points from Sabiston which will help them. So they can add that extra point in Bailey and Lau. So that is definitely very helpful to go for the videos first, followed by books. That is going to shorten your time of preparation. That will be helpful for them, sir.
Okay, sir. And then one more query I've got is, like, suppose you are taking a case of a swelling in the neck during surgery practical. So how do you suggest, like, should they read the entire theory about thyroid and then take the case, or just have some symptomatology knowledge, take the case, then go back, read about the particular case? So how should they be doing? Because many students that I know, they're reluctant to take the case. The reason is they are saying that, sir, I have not read thyroid fully, or I have not read breast fully. So I'm just reluctant to take the case. So, how to overcome that fear for the students?
So it is practice which makes them perfect. They have to keep on presenting. Even if they have not read anything from thyroid, they should present thyroid. This is the place where you can make mistake and learn. The examiners, the faculties, whoever in your college will not definitely scold you for not answering, especially during this period. They may scold you if you're not answering towards the exam. This is the beginning of your final year preparation. Definitely nobody is going to know 100%. So just start preparing the case presentation. As much as case presentation possible, please keep on doing. And another important thing I want to stress here is, I am sure each college will have 10 to 20% of the faculties, extraordinary faculties. So even though you may be attending online classes, so many apps and all, the best faculty is in your college only. The best faculty who can take your hand and keep your hand on the patient's abdomen or the patient's thyroid, and who is going to demonstrate you live with the patient, is never to be missed. So select such faculties. There will be some faculties in each subject. For example, there will be some surgery faculty who will be very, very sincere and dedicated in teaching the students. Keep following that faculty. Whenever there is a class happening by that faculty, wherever posting you are, try to attend that faculty. And always when we are final years, we request some faculties to take evening class during their duty times. If you are going to request, I'm sure those faculties will definitely love that, because nowadays when the student is ready, teacher appears. When you are ready, there will be a teacher coming there who can teach you extraordinarily. So try to ask the faculty who is the best in your college. Ask him to take classes with a live patient. Ask him to demonstrate the science. You go and see the science in his presence. That will be definitely going to help you in long term. See, I have learned murmur only by one faculty in the evening class. I go for an evening class in another college. I am from 𝗥𝗵𝗂𝗏𝗧𝗏 Medical College. There will be a class running in Madras Medical College. Some group of students, we used to go for Madras Medical College, where there will be one evening, one faculty will be teaching medicine classes. We used to attend that class. So none of our faculties in our institute taught about the murmurs such extraordinarily like a faculty from another college. So you should never hesitate to move towards the best faculty. Wherever a live faculty is available, you should go and learn. So learn as much as possible. Very important.
Yes, sir, just one more query. This is a general query. You might also know that now there is a trend of students going for shortcut resources. So personally, I would always vouch that a corresponding subject, especially clinical subject, has to be learned from a subject specialist. So, sir, can a student, learn surgery from any sort of shortcut resource and have good solid knowledge?
Very simple question, sir. If you are going to have a hernia, will you go to a surgeon or to somebody else? That is a question. Same way it is learning of the subjects. So if you have a hernia, who will you go and operate? Will you go and operate from other specialists? For example, from a physician or from an OGN, will you go and operate your hernia? You have to operate it from a surgeon who knows which nerve is coming where, which nerve can be compromised, which nerve should not be compromised. So it is same. Reading of a final year subject is same like treating one patient in front of you. So if you learn from a faculty, I will challenge one simple challenge. You take one topic. For example, you take one topic like cancer breast from a surgeon's class, and you take the same topic, cancer breast, from the multi-specialty faculties, you will know the difference. You will know there is a big difference, like a mountain and a base. There will be that much difference. So don't take into shortcuts. I'm telling you, you might have been a poor student for the past 3.5 years. This 1 year is going to save so many patients from you, either positive or negative. You might sometimes save a patient, and you might save yourself from killing a patient unwantedly. So be careful. This year is a very serious year. Please put 1 year dedicated preparation. During your house agency, you can enjoy. During your PG preparation, you can enjoy. But this 1 year is life. So don't take risk by using multi-source faculties, shorter cuts. Don't go for that. I'm already advising not to use any other books except Bailey. So that too, I'm going for other Indian author books, including my clinical case book, because the time is not sufficient for a final year. So therefore, surgery is not a big task to finish. I'm sure you all will finish surgery. That is difficult subject in the final year is medicine. So actually, even when I'm preparing final year, I got so much of stress only in preparing medicine. You know very well, I have prepared clinical case book in surgery, pediatrics, OBG, but I never opened any medicine book. The problem is that much complicated. I could not understand many concepts during the medicine. Sir, you have to explain how to approach medicine. For example, each topic, they should be strong in clinical or they should be strong in theory, because I don't think surgery, they will be having any difficulty. So please give some tips on medicine, sir, on preparation.
Yeah. So thank you, sir. I think we'll now discuss some points about final year medicine preparation. So just 1 second. Yeah. So as far as my subject medicine goes, first of all, I'll discuss about number 1, theory preparation. Okay. Now, what I strongly believe is medicine, as you all know, is a vast subject. So number 1, don't make the mistake of reading any textbook from A to Z, the first line to the last line, unless you are someone who has prepared very well so far in your MBBS career. Then there is no problem. You know, you have all your basics are strong. You can definitely go in that method. But if you're someone whose basics is not that strong, it is very important to prioritize. But prioritization should be, you know, it is actually something which requires a lot of thinking, what to prioritize and how to prioritize. So I'll just tell you with the example of one system. For example, I'm preparing, say, cardiology or pulmonology. Let's take pulmonology. I'm going to start that module. Now, number 1, you have got to decide your resource. You are going to prepare from which resource. You may have a text, you may or may not have an app subscription, whatever it is. You are first going to decide what is my resource. Now, suppose you're going to follow a particular faculty. Suppose you are listening to my lectures. So you have decided that, okay, I'm going to listen to, you know, my medicine lectures. Now, what you should do is you first look at the previous year university question papers, just to get an idea on the high priority topics. And now you find that, okay, pulmonary function test has been asked as a short answer. Oh, it's a basic level question. So, but they've asked that also as a short answer. And then you see the possible essay questions. Pulmonary embolism has been asked as an essay question. All right, I did not expect that pulmonary embolism is an essay question. So you see what are the questions which have been asked for short answers, what are the questions that have been asked for the essays as well. You just write that in a piece of paper or your diary, whatever it is, just to give yourself an assessment on what are the high-yielding topics from pulmonology. Now you open the app, like if you're opening a DocTutorials app. So you already noticed that pulmonary embolism is a long essay question. Now, then you are seeing that there is my lecture on pulmonary embolism. What you have got to do is watch that lecture first. Now, you watch that lecture first, and then you may or may not read the textbook. I'll tell you why I'm saying. See, ideally, after watching the lecture, you can watch you can read the textbook. But I know that some students, they might have a time constraint. One thing I can assure you as a faculty is whatever I teach will be from the standard textbook. Like, I am not teaching you based on any other textbook, only the most standard textbook and the updated guidelines I'll be teaching you. So what you can, like, even if you don't read Harrison, whatever is most important from Harrison at your level, I am not just going to repeat whatever exactly is said in Harrison. then that would serve no purpose. I'm trying to simplify medicine for you. So I would simplify it in a manner so that once you read it, and once, like as of now, the DocTutorials hard copy notes is also available for purchase. So suppose you have got the hard copy notes, that might actually save more time. Okay, it might save more time. And especially for many students who have messaged me, sir, is there hard copy notes of DocTutorials? Yes, we have got the hard copy notes, so that can actually save more time. You can watch the lectures and you can, add, if at all, any extra point in the notes itself. Now you read that, and meanwhile, you just have a look at the sub-questions. What are the sub-questions that has been asked from pulmonary embolism? They have asked about diagnosis. They have asked about the investigations to be done. And maybe the clinical scenario that came up in the long essay is that of a massive pulmonary embolism. And you must know how to treat pulmonary embolism. And when you write an answer in your exam, this is also very important. See, for attending essay questions, some students make a mistake. Suppose they learn pulmonary embolism, and they are writing the answer of the essay. There will be a case scenario in the question. Suppose the patient is presenting with sudden onset breathlessness. The patient recently had a fracture of neck of femur and has been immobilized for around 3 to 4 weeks. Patient has sudden onset breathlessness and patient is in hypotension. So the moment you know that the patient is in hypotension, it is likely to be a massive pulmonary embolism. Now, when you write the treatment of that patient, remember, you have to write how that patient is going to be treated. Some people make the mistake, they'll simply outline the entire management of pulmonary embolism, which may not give a good impression to the examiner. What you have got to do is, you have got to manage that particular case. You must write in the answer, this is likely to be a case of massive pulmonary embolism. So massive pulmonary embolism, I will be going for intravenous thrombolysis with alteplase. Okay, so, and it is always better that you know the dose, at least of common conditions. Many final year students I've seen, I get a lot of messages, sir. They ask me, like, which are the conditions for which we should learn the dose? Dose should be learned for commonly asked questions. For example, meningitis. You have to know the dose of ceftriaxone or vancomycin for meningitis. You have to know the dose of the thrombolytic agent alteplase for your stroke. So certain conditions which are commonly asked as essay questions, as well as important short answer questions. For example, leptospirosis. Leptospirosis can be asked as an essay question. How do you manage leptospirosis? Scrub typhus, again, commonly asked short answer from your infectious disease part. You have got to know. HIV, possible long essay question. You have to know the dose. But there will be certain conditions which are relatively rare. And I don't think, if you can remember, well and good. But otherwise, it's okay that, you don't know, that is fine. But at least for common conditions, you have got to know the dose. So as I said, decide the source from which you are learning. Then you watch my pulmonary embolism video. And then you look, what are the top questions? The topics from which the questions have been asked. Obviously, there will be a few topics which are important maybe for PG medical entrance, but not very important for your theory exam. What I would suggest to you is, you prioritize. You first finish all the questions that are previous year questions. Then that will give you a confidence as well. At least I've gone through previous year questions. Then depending on your time, go for other questions as well. I'll tell you one example. So recently also in one Tamil Nadu university, one of the university essay question was on zinc phosphide poisoning. And which was not expected. Students did not expect that. So, but still it can feature out. And even for the, one of the recent exams in Kerala for pediatrics, the long essay was on diphtheria, which is not usually an asked essay question. So you can have surprises. The problem is, if you entirely rely on previous year alone, sometimes when there are surprises, you might find it difficult. So what I would suggest to you is, the chances are that the questions are more likely to be asked from the commonly asked questions. You first finish pulmonology, you look at the previous year topics and finish those modules first. And depending on the time you have got, then you see that, okay, there is a video on hypersensitivity pneumonitis. Let me just watch that video. I would not recommend you, watching the video of hypersensitivity pneumonitis first. So what I would suggest to you is the video lecture based on the high yield topics. And then immediately after you finish a few modules from pulmonology or even the entire pulmonology, you please practice MCQs. You try to assess whether you are doing it in the right way or not. This is how you should be doing for every system. Pulmonology, like neurology, cardiovascular system. I think, that would actually help you. And remember, it is very important to decide the source. Even Rajamahendran sir was telling, it is important to learn from a subject specialist. Rajamahendran sir, when I recently took a class for, in a face-to-face class recently, I asked them about management of stroke. And one student told me that, sir, I asked which agent can be given for stroke thrombolysis. So student answered streptokinase. I said, why did you answer? So it is a recombinant tissue plasminogen activator. I said, is streptokinase given for stroke thrombolysis? The student said, yes. I said, what is your reference? The student had learned it from a shortcut class. Actually, streptokinase can be given for thrombolysis in myocardial infarction, but it is never going to be given in stroke thrombolysis. You will be in jail because the only two approved agents for stroke thrombolysis, you can either give the patient alteplase or tenecteplase. Okay. So the problem is, when you learn from another specialist faculty about medicine, they might be reading some question and they might think that, okay, all the recombinant tissue plasminogen activators can be given for thrombolysis. And you will learn that thinking, okay, this is fine. I've learned in a shortcut manner. So many of the fancy, guidelines, I've seen some student forwarding me, sir, I've got a simple guideline on stroke management. Is it correct? Again, I've learned it from shortcut source. It is absolutely wrong. It might apparently be simple, but it is wrong only. So I would agree with Rajamahendran sir. When you learn from a practicing clinician or a surgeon. That would actually help you. Okay. So that is it about theory exam. Practical exam. Again, as Rajamahendran sir said, please take cases. Many students fear taking cases of medicine just because, sir, I don't know anything. You've got two choices. Either you take the practical cases during your postings and get embarrassed then, and then shine well in the final exam. Or you refrain from taking the cases. Your friends might take the case. They might get embarrassed and you might also join the crowd in laughing at them because that is happening often in final MBBS. The presenter, gets all the scoldings. But remember, always in a case presentation, the person who benefits the most is going to be the presenter. He might be embarrassed. He might make mistakes. He might make blunders. But at the end of the session, he gains. He is the person who gains maximum. So you decide for yourself whether you want to be embarrassed now or you go to the final exam and get embarrassed then. So please take cases. Even if you have got half knowledge or no knowledge, somehow take cases. And I would always suggest that you prepare some prototype cases. Like once you make the case, I would suggest don't take the case, sir. What often happens is like you spend good amount of time taking a stroke case, a hemiplegia case, you write the entire thing, you present it to the faculty, you come out of the class and then throw that paper in a dustbin. Please don't do that. You please keep it with yourself because towards the exam, when you want to once again go through the case-taking format, when you go through your own handwriting and the mistakes you made, it will help you that time. So you must take cases and that particular notebook, it should be kept in a notebook, not in any paper. You please preserve it so that towards the end, you will actually, you'll be benefited by that. So that is what I want to tell you from the practical point of view. And also as Rajamahendran sir said, see coach, we as faculties can help you, but always please touch the patient. How much ever you know about your theory, if you don't touch the patient, you are not going to be a good clinician. Okay, so please examine the patient. Many students, they would read about examination of spleen, read about eliciting an ankle jerk, because examiners know, like, sir, if I am the examiner and if I am coming for your exam, one of the signs that I would always ask you is elicit the left ankle jerk, because the way you hold it, when you examine from the right side of the patient and how you hold the feet, I know whether you are doing it for the first time in your life or you are already done it. So I would always request you, please practice. Even if it's a simple jerk, you just look what is the position, what is the ideal position you have got to look, and that you keep practicing again and again. Okay, so that is what I want you to understand. You keep practicing again and again about these practical sessions. And sir, as far as my subject is concerned, I have formed WhatsApp groups, especially for each state, because they've got different type of questions being asked. I've got groups for Kerala, Tamil Nadu, Karnataka, Andhra, Telangana, Delhi. So if at all you have not joined the group, please join the group. I'll be very happy to help you in the group. What I usually do is that whatever cases I see in my routine practice, I do share it with the students so that you get the experience of the cases. I would also request you to go through the Instagram reels of our faculties as well. There are some very interesting reels. If you go to Rajamahendran sir's Instagram page, you've got Surgery Sixer. You just type Surgery Sixer. Sir actually uploads very short reels. But if you just watch that, you get that actual experience also. Okay, this is how. And these are very useful. I think Rohit Daniel, sir, lot of useful reels are there. His Instagram page, Gayatri Madam. So lot of final year faculty, Sandeep Sharma, sir. So you please go through their Instagram page to watch some useful reels as well. So this is what, I've got to tell you in a nutshell about medicine and surgery preparation. Just to tell you that keep along with all this, what myself and Rajamahendran sir has told you, I would always tell you one more thing. One very important thing. Amidst this stressful year, have good friends, which will give you peace. Don't make unnecessary fights, because in life, you've got many things to get stressed about in final year. And don't create any additional stress for yourself. So keep your mind calm, have good friends, eat well, sleep well, enjoy your college life also along with this, because these days are not going to come up again. So enjoy your life also along with this. But as faculties, we'll be very happy to help you. And Rajamahendran sir, for DocTutorials, I think we have currently come up with a final year pack exclusively for students preparing for final year, so that yes, you can prepare with us. And one thing I can tell you is we'll be guiding you at all steps for your theory exams as well as practical exams. Rajamahendran sir, any point you want to add regarding?
Yes, sir, correctly told. There should be no fight among the friends. Usually this final year period, there will be so many clashes among the students. I always recommend to form small group, like 3-4 students together, form a good group of preparation. So you should discuss. The most important key to clear this final year easily is by discussion. So form a good team and keep discussing with each other. Okay, that is more important. Sir, so we used to have a small group.
Just to interrupt on that point. So something that I used to do, just like the point you said, in final year, we used to form, like when we came back to the room, I was a day scholar, but still I used to go to hostels. So when we actually, like one day in the medicine posting towards the evening, we had a group of 6 friends and 6 of us were posted in different units. And we quickly discussed the important points that were discussed in the unit in that particular day. And then we used to exchange. So what is the advantage? Every day, I get to know the important points discussed in all units, all medicine units, M1 to M6. I did my MBBS from Government Medical College, Trivandrum. So whatever was discussed in all the 6 units, I learned in one day. So my friends are also benefited. So we form such short groups, sir. Okay.
The group discussion is very important in final year, sir, because we can add up whatever we have read already, we can add up extra points. That will be helpful. And especially sometimes what happens, no, our chief will not be an examiner. The examiner will be the other unit chief. So if we don't know the other unit chief points, we will be having a trouble in the exam. So we always used to write the notes of other unit chiefs also, because we don't know who will come for the exam. Sometimes the first unit chief will come, sometimes the second unit chief will come. So we have to discuss with other unit friends, form a small team and keep writing notes on all the content. That is very important. So thank you so much, sir. I think you have to read the comments, sir. So many comments have come. Shall I read the comments for you?
Yes, sir. I can see the comments.
Yes, sir. 𝗥𝗵𝗂𝗹, from 𝗥𝗵𝗂𝗹, we have not answered. From 𝗥𝗵𝗂𝗹 is asking, is it necessary to do custom modules? So, sir, I think 𝗥𝗵𝗂𝗹 is a PG aspirant.
So is custom module or all the way of preparing is fine. 𝗥𝗵𝗂𝗹 is asking when to join T&D. See, 𝗥𝗵𝗂𝗹, if you are a final year student, I think you can stick on to the final year pack of DocTutorials and whatever discussions and revision videos you can do during your internship, if at all you are a final MBBS student. But if you are a post-final MBBS student, I think, if you have reasonably prepared from some source, that is when you should be joining T&D. If your basics are not at all correct, I think you should go for the full lectures. But if you are reasonably thorough, you can go for the test and discussion. Okay.
Yes, sir. There is another question from 𝗥𝗵𝗵𝗂𝗵. What to do when new edition comes suddenly? So actually, for surgery, I can assure there will be no new edition coming from Bailey, because Bailey is the latest edition, just released some 8 months back. So I don't think you need to worry about the change of edition in surgery. Sir, what about medicine? Any new edition expected?
Sir, no, sir. As of now, I think, the Harrison 21st edition actually came recently only. I think there is not going to be a change. And sir, one question, Kishan Soni is asking, MCQ के लिए कौन सी book लेनी चाहिए? See, let me just tell you that one thing I can assure you is that the QBank of DocTutorials, just go through that, the new QBank once, and you will feel the difference. Because see, if you're doing surgery, the entire question bank is framed by Rajamahendran sir. So you will not have errors. The good thing about this QBank is that they are put by faculties, and no other platform has a QBank that is entirely framed by the faculties. So Kishan Soni, there is no book. You just go for a faculty created QBank. It is very good in for DocTutorials platform. Okay, right. So some student is asking, how can we approach for NEET PG in our final year? I think we have already discussed that. Side by side, along with your theory, please do the QBank as well. I think the most important thing is you be in sync. If you watch one faculty's lecture and then do QBank from another platform, it will not be useful. If you're planning, like suppose you're listening to Rajamahendran sir's lectures, it is always better you actually solve question bank that has been framed by him or myself, or maybe Sandeep Sharma sir, or maybe Gayatri madam. Because then, the question bank will be like that. Okay, and many of our faculties are products of central institutes. Like Sandeep Sharma sir is actually done his MD Pediatrics from PGI Chandigarh. Dr. Gayatri has done from AIMS Delhi. So, they are used to the INI style of questions as well. So the question bank has a mix of questions which will help you both for your NEET PG as well as INI as well. Okay, right. So Vinesh, so glad that you liked the session. Yeah. So one student is asking, can you arrange sessions for OBG and pediatrics? Definitely, that is also going to come. So all of you do subscribe the channel so that you actually get notifications on the subsequent sessions. So please stay tuned to the channel. Okay, right. So I think that's it.
Yes, sir.
Yeah. So
thank you, sir. Thank you. It's an extraordinary session, sir. You made a clear idea on entire preparation. Even I got some idea how to be prepared.
Thank you, sir.
Yes, sir. Thank you, sir.
So, just last point, just to wind up the session on a note from which Rajamahendran sir said, final year is about smart work. Because, when we were discussing about that group study, I still remember one of my friends asking, one friend asked my friend, how to elicit triceps jerk? And he said, you want M1 units triceps jerk or M2 units triceps jerk? Because every faculty also might have a slightly different method of doing. So I think it's important to know about the method that is followed by each unit faculty. And that is how I did something smart where we formed groups from different units, sir. So that's one, tip for you. Thank you so much, all of you, for joining, and stay tuned for more such sessions. Sir, any closing comments?
No, sir. Thank you, sir. Thank you. We will be meeting them again and again in future.
Sure.
Okay, sir. Thank you, sir. Thank you, sir.
And do join the DocTutorials groups for the respective states. Yes. We have got groups. So, you can contact your DocTutorials ambassador. Like we are forming individual groups for different states so that we'll discuss some questions that are asked in your university exams accordingly. All right. Thank you so much for joining, and all the best for your exams. Thank you so much.
Thank you, sir. Thank you, sir. Thank you so much.